Now that Medicare Annual Enrollment is here, I have 4 super easy and fast action steps for you that are going to make your life a whole lot easier and possibly put a pile of money right back in your pocket. With that being said, let's jump into the steps. Now, first off, if you're not sure what Medicare Annual Enrollment is, let me explain super fast. It's a time frame that opens up every single year between October 15th and December 7th that allows anybody, 70 million people that are currently on Medicare, can go in and out of plans all that they want during this 7-week window. This is called annual enrollment. Comes around only one time per year. That is why it is so incredibly important right now. And literally every single person on Medicare, 70 million people, should be getting a review to make sure that they are properly covered. And again, that's what I want to focus on because it can also be a very confusing time. I am literally shopping plans right now for me personally as well during this time frame. It can be very, very confusing looking through all the plan options that are out there. And again, that's the purpose of this video, is to make your life a whole lot easier during this time. And I am literally doing this for myself as well. So I'm literally just sharing with you what I am personally doing right now to make my life easier and to get money back. All right, so step number 1. I want you to think about your personal situation. This is going to be different for every single person. But with your personal situation right now in 2025, and what do you foresee going forward for the next year? Okay, what I mean by that is what you need medically right now, as in whatever medical necessities or whatever medical coverages that you need right now. Do you foresee that your situation is going to remain the same, or do you foresee that you're going to need additional or possibly less medical coverages going forward for the coming year? And again, you really got to assess your own personal situation. What do you foresee for the coming year, right? And again, take into consideration everything: hearing, dental, vision, prescription coverages, as well as just all the other coverages you can think about, right? So really think about that and maybe even pull out a piece of paper or just write this down however you do and just take note. Yeah, I plan on doing this in the coming year, or my health is X, Y, or Z. I may need to get access to these services or whatever in the coming year, okay? Just take note of that. Very, very important. Write down, just take note of whatever it happens to be for your situation, and just take all that in consideration, because during annual enrollment right here, right now, not only are we looking at different plans that'll cover us at the moment, but also we need to anticipate what do we think may be coming for us medically in the next year that this plan would also need to cover for us. Does that make sense? Very important aspect of this, okay? That's number 1. Number 2, write down your list of questions. I know you've got questions about your current plan, any other potential plans that are out there to get you coverages, whatever questions you have. Hey, is this one thing going to be covered? How do I get covered? That's another thing as well. A lot of people say, is it covered? But another question we should be asking is, how can I get this covered? Okay, that's another key question, because maybe the current plan that you're on right now may not be the best option. Maybe it is, maybe it isn't. Again, that'll be coming up here in just a minute. We'll cover that a little bit more clearly here in just a second, but that's another really big one, okay? Write your list of questions. Any and all questions that you have, either on Medicare, your current plan, any potential plans that are out there, whatever it happens to be, anything that you possibly want coverages for, write your list of questions down. That's number 2. Number 3, write your wish list down. Again, I talk about this in the videos like nobody does this. Write your list of not only your questions, but your wish list as well. Believe it or not, this is the time of year right now during annual enrollment where you literally get to whip out your paper and say, "Dear Medicare, I want XYZ," and write down your wish list. Yes, it is a thing. Do it, okay? Like nobody does this. A lot of people are just like, "Oh, what do you got for me?" And I'm like, here's what I want. Here's my list of 10 requests. Let's get my list of requests done, okay? Now, it could be anything. Your wish list being, hey, my plan that I had this year, I like it, but the premium was too much. Okay, write it down. Premium's too high. I want a premium under X dollars. Or this as well. As far as on your wish list, do you have a specific doctor that you want to see, or maybe 2 or 3 different doctors that you like? Write it down. That's your wish list. Do you have a specific clinic or office that you like to go to? Write it down. That's on your wish list. How about a certain hospital system? Is there a certain hospital system that you want access to in the event that something happens where you need to visit a hospital? Write it down. We all have preferences on these things. Next, do you want prescription coverages? Write it down. Yes or no. Do you want hearing, dental, or vision coverages? Again, yes or no. For example, I'll tell you this for me personally. I don't necessarily, I'm just going to be fair with you, I don't really care that much about hearing and dental coverages all that much. I mean, it's important to me. But what I really want for me personally, I want vision coverages. Why? Because I'm blind. I have something called retinitis pigmentosa. My eyes don't really work anymore, right? You might be like, but you're looking at the camera. Well, I've done this like a lot of times, like thousands and thousands. Like I have like 6,000 videos on the channel, so I know where my camera is, right? So I kind of like know where to look. I can't see the camera. I promise you, I cannot see the camera. My point being is that when I'm shopping plans, I want to make sure that I have access to the retina specialist that I want to see, so that I can go see them and they can shine super bright lights in my eyes and dilate my eyes and be like, "Yep, still can't see," and I'm like, I could have told you that, right? But my point being is that, to me, that is very important. That is one of my preferences and is on my wish list. I need a plan that gets me access to the retina specialist that I've been going to and that I need to continue to see to, make sure that, hey, you don't got something, other weird things going on with my eyes. So that's a situation for me. That's something that's very important to me, okay? Now, write all that stuff down. Take note exactly what you want. Take preferences, whatever it happens to be. Okay, so now that you have all this written down, number one was basically what's going on with your medical situation. Do you need extra coverages? Do you need less coverages? Do you anticipate something coming up in the coming year here that you really want to have covered or that you really want to have done? Maybe it's a procedure, maybe it's a surgery, something like that. That's important to know. Very important to know, especially when you're shopping for a new plan, okay? And number two, your list of questions. We've all got a list of questions. Write that down, keep that, and take note of that. Number three, your preferences. What is it? It's going to be different for all of us. What about you, right? Do you want prescription coverages? Yes or no? Hearing, dental, vision? Yes or no? Offices, clinics? Yes or no? Certain doctors? Yes or no? Hospital systems? Yes or no? Again, what do you want for premiums? Write that down. It's another key question. How much do you want to pay for a premium every month, right? Up to X dollars or below X dollars. How about copays? Have you thought about that as well? Very important. Your copays are also important. How about coinsurance or max out of pockets or deductibles? All of this, right? So many different things to think about when it comes down to it. Okay, so now that you have all of that compiled, those are the first 3 steps. Step number 4, you've got all that compiled. Number 4, call that phone number. You've got that phone number right there. It is a 100% free service. Once you have all of that data, call that phone number. You'll connect with a real human, not an AI, not a robot, not an automated system, a real, live, warm, breathing, blinking human, okay? The real deal, not some AI bot that pretends to be a human. A real human with a real name and a real family and probably, just real everything. Anyway, that individual's going to spend time with you on the phone. They're going to talk to you. They're going to ask you a couple questions. Now that you have your list of questions, your preferences, and your list of all the things that you foresee for the coming year, you can rattle all of that off to them and say, here is the list that I've compiled, thanks to my friend Matt on YouTube. Yeah, thank you so much for watching this. I appreciate all of you, by the way. I'm just trying to help you through this, by the way, because I'm literally doing this myself, okay? Anyway, you can rattle off that list to them. Here's what I want. And here's the thing. When this person gets all this, they're going to be like, wow, you're prepared. And you're going to be like, heck yeah, I am. For sure I'm prepared, right? Awesome. Yeah, exactly. You're going to be prepared. That's going to be very, very good. Very good, okay? And then, not only that, they're going to go through their database of 20,000 plans, and they're going to find the best plan for you based on everything that you've rattled off, everything in the first 3 steps that I gave you in this video. You can rattle that all off to them, and they will find it within minutes. They will have an answer for you of, here is based on everything that you want, everything that you need. here is the best plan for you and your personal situation. It's amazing. You're going to save yourself a ton of time, possibly put a pile of money back in your pocket, and it's going to save you a ton of time, frustration, confusion, and that's that. Boom, wham, bam, thank you so much, and that's it. You're awesome, okay? You will be so good at that point. It'll offer you so much relief. You'll be able to sleep better at night knowing you have the best plan that's out there for you and your personal situation. And I'll point this out as well. That phone number, over the last several months here, people that have been calling that phone number have been saving hundreds and thousands of dollars per month and per year by calling that phone number. Absolutely incredible. That's what I mean by that. By putting possibly a pile of money back in your pocket, I could rattle off a whole bunch of names right now from people that I've given shoutouts to recently in videos that have called that phone number, talked to them, and are saving a ton of money. In fact, the average savings from people here in this community is $1,100. That's the average savings. That's just average. That's a little less than $100 a month. That's average. I could tell you a lot of people like Ken Johnson, who's saving $174 a month, Ed Fitzpatrick, who's saving $170 a month, Barbara Welly, who's saving $154 a month, Beth Conley, who is saving $310 a month, Deanne Smock, who's saving, I think she's also $154 a month. Yeah, Deanne Smock, also $154 a month. The list goes on and on from all of these people. Vikings Bears, $1,000 a year. Kathy McConley, I think I'm saying that correctly, Kathy. She's saving $2,000 a year. Again, the list goes on and on from all the people in this community that have reached out to me down below in the comments section with their savings after making the call there. That'll make you so much more prepared. It'll make your life so easy. Do me a favor. Call them. After you call them, just give them a call. After you do, drop a comment down below. Let me know. Did this list that I gave you, 3 simple, fast steps and action steps to take, did that make this interaction way easier and make your life easier? Drop some comments down below after you talk to them. Was that helpful? By the way, after you talk to them, drop a comment down below. Let me know how it went. And, if you want to share, whatever. And then I'll give you a shout out in a future video, just like I did to a bunch of people here in this video right here, okay? Anyway, I hope that helps you out. But now that we're at annual enrollment, remember this much as well. This is only a 7-week window. It's still early on right now, but this window is going to whittle away relatively quickly, especially with the time of year it is, the holidays coming up and all stuff like that. It goes super fast, okay? Point being is that time is of the essence. Take advantage of that phone number. It is 100% for free, which I've said a couple times already. It's 100% for free. Call them. They will go to work diligently on your behalf immediately, one-on-one with you, working with you. And you can whip out your list of questions. You can whip out your list of preferences. And you can whip out your list of different things that you need or you foresee coming for the coming year. And they will make sure that you are properly covered. It's incredible. You're going to be shocked. You're going to be impressed. You're going to be happy. And let me know how it goes. After you talk to them, drop that comment down below. Now, let me ask another favor of you. Who do you know? I know that you know, like, a lot of people on Medicare. I know for a fact you do. There's 70 million of us out there that are on Medicare. Share this video with them, please. There's a share button down below. Share this video with them. Friends, family members, neighbors, acquaintances, siblings, coworkers, parents, neighbors down the street, neighbors down the hall, your social media. Please share this video. There's a big share button down below. If you don't want to do that, at least share that phone number with the people that you know that are currently on Medicare so they can get a free review. Just take a picture, take a screenshot, write it down, whatever you got to do, send it on over to them and say, here, do yourself a favor, call this, get free help with your Medicare to make sure that you're on the best plan, and you might even get to save a bunch of money. And then after you do get to save money, you can take me out for a treat or something like that, right? You could tease them like that. Say, you get to take me out to ice cream when you get to save $1,000 or something like that, right? Who knows? Maybe you'll get an ice cream treat out of the deal. How awesome would that be, right? All right, anyway, I hope this helps you. Please subscribe if you're new here, 100% free. Big subscribe button down below. Please share the video, share button down below. Check out the other 6,000 videos here on the channel in the video library. Share that phone number with your friends, family, social media, anybody that you know that is currently on Medicare. Share that. This is a short window. If you have not done so, call them immediately. Take advantage of that. and I hope this helps you. I know for a fact this will help you, okay? That's how confident I am about this. I know for a fact this will help you. This video and that phone number. Anyway, let me know how it goes. Drop the comment. Make sure to use the word chapter. That's the keyword that I search for across the channel, and I'll give you a shout out in a future video. Enjoy your day. Thank you so much. Hope you have a nice one, and I look forward to reading your comments down below. All right, anyway, until next time, take care.